So hello everyone and welcome to the case 7 of this Osce series, and today we'll be discussing a very interesting case. So here we have a 28-year-old female with chronic pelvic pain and dysmenorrhea, and I have provided you with some MRI pictures of this patient. These are the axial sections, T1 weighted images and T2 weighted images, axial section. We can determine that by looking at the bladder, which is hypointense on T1 and hyperintense on T2 weighted images. I'll give you some more pictures in the next slides, and based on these pictures, what are the findings in the diagnosis and what are the differentials for this condition. So I'll give you some time to appreciate the findings. These are the T1 weighted images, and there is a cystic lesion which is appearing hyperintense on T1 weighted images, predominantly hyperintense on T1 weighted images, the lateral side, left lateral side in the myometrium of the uterus. These are the T2 weighted images, where again this heterogeneous cystic lesion is seen. Here is sagittal sections of T2 weighted images, where this endometrial cavity is very well visualized, and this is the cystic lesion in the left lateral myometrium, which is appearing heterogeneous in signal. These are the T1 weighted coronal sections, where again this endometrial cavity is separate, and the cystic lesion, which is appearing T1 hyperintense, indicating some blood products within it, is seen on the lateral side. So the findings here are that there is a cystic lesion with hemorrhage in the left lateral border of the uterus, which appears heterogeneously hyperintense on T1 as well as T2 weighted images. So based on these findings, what do you think the diagnosis is in this case? So the diagnosis in this case is accessory and cavitated uterine mass, or ACUM. The imaging criteria for the diagnosis is there is an accessory cavitated mass along the uterine wall under the round ligament. The uterus appears normal along with the fallopian tubes and the ovaries. The adnexae were normal. The blood products are seen within the cavity or cystic lesion, and there is no adenomyosis as say in the main uterus, but features of adenomyosis can be seen in the ACUM. MRI will typically show an accessory cavitated mass along the uterine wall under the round ligament with T2 hyperintense endometrial lining and blood degradation products in the cavity. So coming to differentials, there are two main differentials that we have to remember for ACUM. One is easily differentiated, that is cystic degeneration of a leiomyoma. Leiomyoma shows cystic degeneration only when it outgrows its blood supply, so it has to be very large in size. Secondly, cystic degeneration is very rare in a leiomyoma, and it will be appearing T2 homogeneously, T2 hyperintense, not have blood products within it. This is a large leiomyoma with cystic degeneration within it. So this can be differentiated from ACUM, but it is very difficult to differentiate a unicornuate uterus with obstructed rudimentary horn. That is, this is a rudimentary horn of the uterus, and there is a hematometra within it. So it's very difficult to differentiate this particular condition from ACUM. So it's a closed differential, unicornuate uterus with obstructed rudimentary horn.